Welcome to the emergency department at Good Samaritan Hospital. It's our job to provide you with quality care in a safe, efficient manner. In the triage area, a registered nurse evaluates each patient seeking treatment. Every nurse is trained to assess the patient by asking for basic medical history and a brief explanation of the illness or injury that has brought the patient to the emergency department. After the patient has been triaged, the nurse will decide who needs to receive treatment first. This decision is based upon the seriousness of each patient and the number and types of treatment rooms that are available. Life-threatening conditions or those that may result in permanent injury or loss of limb will always be seen before those that are of a less serious nature. Other factors which play a role in determining the order of treatment include the number of patients arriving by ambulance, whether or not patients who are admitted have an available room ready in the hospital to be transferred to, and the patient's ability to understand and reason. Regardless of why you came to the emergency department, it's important you provide the triage nurse a list of your current medications, any allergies you may have, and any over-the-counter medication or herbal supplements you're taking. Please be as complete and accurate as possible. Your care depends on it. In order to prevent the spread of infection, if you have a cough or flu symptoms, please cover your mouth when coughing or sneezing with the bend of your arm. You may be asked to wear a mask to protect other patients and their family members who are waiting. Washing your hands or using hand sanitizers are the best ways to prevent the spread of infection. Depending on how busy the ER is, sometimes waiting times can be lengthy. If the nurse, lab, or X-ray technician comes and you are not in the waiting room, they will move on to the next patient. If you need to step out or leave, please let the staff at the window know. Your comfort and well-being are important to us. If you feel your condition is getting worse, please let our staff know immediately. For your safety, we are not able to give pain medication to patients who are waiting. It's also important that you do not eat or drink without first getting permission from the doctor or nurse. Doing so could affect your condition or our ability to treat you. If you have to use the restroom while you wait, please let the staff know, as a urine specimen may be needed as part of your treatment. Informing the staff will allow them to provide you with a urine collection kit. This can greatly decrease the amount of time waiting once the physician sees you. Once you arrive in a room, you will be seen and cared for by a team of professionals, which could include a technician and a registered nurse. In addition, a nurse practitioner, physician's assistant, or physician will evaluate and care for you. While in the treatment area, you may have an intravenous or IV line started, laboratory tests drawn, X-rays, or an EKG completed. All of these tests provide your caretakers with important information and could take time to complete. When the ER is busy, the staff will make every effort to inform you of any delays and attempt to minimize your waiting time as possible. Please feel free to ask the staff about any delays or concerns that you have. Once testing is complete, a decision will be made as to whether or not you will be discharged home or admitted to the hospital. If you are discharged, you will receive written instructions from one of our staff members. Please let us know at that time if you have any further questions or if there's anything else we can do for you. If you are being admitted to the hospital, an inpatient room may or may not be ready for you immediately. The time it takes for you to get to a room in the hospital depends on how quickly the admitting doctor gives your admission orders. Whether or not a bed on the type of floor the physician you requested you be placed upon is ready, and whether or not you have testing that has been ordered to be completed before you can be taken to your room. If your visit has not gone as expected and you have concerns about your care, please contact the charge nurse or any member of our leadership team prior to your departure. We are concerned about your care and your well-being and would like the opportunity to assist you with these issues as they arise. Because Good Samaritan Hospital is not responsible for the loss or damage to your personal items, if you are admitted to the hospital, please send your money or valuable items home with family members or request they be locked in our safe. Any member of our staff can assist you with this. We know how important it is for you to have the support of your family while you're being treated. We ask that only the patient is brought into the triage area due to the space constraints and the privacy of others. When you are taken to a room, we request only 2 visitors come back with you to the treatment area. If more than 2 people are here with you, please alternate visitors so that there are only 2 in the room at any time. All visitors are asked to stay in the patient's room. This helps keep doorways and hallways clear, and the privacy of you and other patients is protected. We pledge that we will make every attempt to make your visit to Good Samaritan Emergency Department as comfortable as possible. Please talk to your nurse, doctor, or any member of the healthcare team if you have questions, concerns, complaints, or compliments about your care. After your visit to Good Samaritan's Emergency Department, you may receive a survey in the mail. Your feedback is important as it helps the hospital continue to improve our care. Again, thank you for choosing Good Samaritan Hospital and allowing us the opportunity to meet your healthcare needs.